and welcome to Ask the Professionals Q&A. My name is Heidi Sittelmeyer, and I am the Director of Online and Community Connections here at the Arthritis Foundation. I facilitate a Live Yes Connect group, and I am a patient living with juvenile rheumatoid arthritis persisting into adulthood, and now osteoarthritis. Ask the Professionals Q&A is an interactive video series where we solicit questions from the patient community and then bring in leading experts to help us get our questions answered. I have the pleasure of having Dr. Don Miller with us for Ask the Professionals today. Don Miller is a PharmD and his FASHP. I love all the initials after different specialties, and you can explain that later. And he has more than 45 years in the field of pharmacy and is a professor in the Department of Pharmacy Practices with the North Dakota State University. Dr. Miller's areas of expertise include rheumatology and drug literature evaluation, and he is a fellow with the American Society of Health Systems Pharmacists. Dr. Miller has authored many journal articles on medication topics, including biosimilars. He is a recipient of the Al Dorr Service Award for outstanding public and professional service to pharmacy. So welcome, Dr. Miller. So how I'd like to go today is we'll just go through and ask you questions and have you answer them. So why don't we start with learning a little bit about you? So tell us a little bit about yourself and why you chose to be a pharmacist.
Well, I grew up in Winnipeg, Canada, and I liked chemistry in high school. So I chose pharmacy for a pretty arbitrary reason. Two of my classmates in high school said they were looking at pharmacy as a career. And then I thought, oh, wait a minute, pharmacy is related to chemistry. So yeah, I think I'll just join my buddies in the pharmacy program. So all three of us did get in, and we graduated with a bachelor's degree in pharmacy, which was a standard at the time. And then after that, I went on to the University of Michigan to get my doctorate of pharmacy degree, and started looking for jobs. North Dakota was pretty close to my home of Winnipeg, so I thought I'll try it for a while, and I ended up being here for over 40 years.
Awesome. I love that story. That's great. So can you tell us a little bit about how you interact with people living with arthritis in your practice or in your job?
Yeah. Well, right now it's probably mostly through the Arthritis Foundation. The foundation has been a big part of my career in many ways, because actually not very long after I got to North Dakota State University, the local Arthritis Foundation put on a program for pharmacists on rheumatoid arthritis. And they had a couple of speakers, one of whom was a rheumatologist locally. And so we started talking and hit it off and found we both had an interest in doing some research. And so I started working with him on some drug company funded studies of new medications. Back then, the first thing we looked at was oral gold. That was a long, long time ago.
Remember that?
And we did some research on our own with methotrexate and some other things. And so I worked with patients there for lasted about 10 years. Then when that rheumatologist left, I wasn't directly involved, but I've stayed involved in the Arthritis Foundation, and also have been active through my career with the American College of Rheumatology, which is a professional organization for rheumatologists and allied professionals.
Well, thank you for your long history and your continued support of the Arthritis Foundation. We really appreciate that. So what piece of advice do you give most often to people living with arthritis in your role?
Well, I'd say the most important thing is find a doctor that you like and you trust. If you have a more severe inflammatory form of arthritis, that's pretty essential. If you have osteoarthritis, it's still important to have a physician that likes treating people with arthritis, is up with current therapies, and again, is someone you can trust. Along with that is having a pharmacist you can trust, because people with arthritis often take many medications, maybe some supplements. And so you'll also want to make sure you're seeing a pharmacy where you can talk to the pharmacist, they explain your medicines to you, and they're monitoring you for drug interactions and things like that.
Well, great. That sort of segued into my next question, which was, how can pharmacists help patients with inflammatory arthritis and then also those with osteoarthritis?
Yeah, most commonly, pharmacists are important as educators. So, you're entitled to counseling from your pharmacist whenever you pick up a prescription, and you should be prepared to ask questions if it's not been made clear from your physician. But pharmacists are also getting involved now in more exciting ways. I know some large rheumatology practices actually have a pharmacist on staff in the practice. That pharmacist not only educates patients, but helps monitor them. They make sure lab work is up to date, and they're available for helping both physicians and patients with questions and problems that come up along the way.
Great. Yeah. So I definitely hear education, you're a resource, and you're an integral part of a patient's healthcare team, because we've got to have our posse following us and taking care of us, right?
Yeah.
All right. So let's move on to the next question. Why do biologics sting?
Well, of course, there are injectables, and anything you inject into your body may sting, but really, usually the stinging is caused by the pH of the product. So the problem is biologics are very large, complicated molecules, and to be stable, they may require a pH that's a little bit on the acid side. And so when you inject that, it's different than being neutral pH, and that's going to cause that. Humira is a good example. It was recently reformulated to be less acidic and therefore to sting less.
So is there anything that I can do to make them less painful?
Probably not a whole lot. If you're injecting it, those usually just under the skin, and so you maybe inject it in an area where you have a little more fat tissue. That'll just help it get absorbed a little faster.
Okay. Does it help getting it to room temperature?
Oh, yes, that's a good point. Yeah, if you've taken it out of the fridge, you probably want to let that warm up to room temperature first.
Okay, perfect. I know for myself, I always let it sit out for a little bit, for sure.
Yeah.
All right. So, here's the next one. Give us the skinny on alcohol and arthritis medications. Can I drink or not?
Well, I would never recommend drinking too much, but probably you're asking a common question is, can I have a drink if I go out to a party? Can I have a cocktail with dinner or something like that? And generally, yes. Where this comes up most often is people taking methotrexate, where you're often told not to drink alcohol. There's a lot of controversy and disagreement among rheumatologists on what that means to avoid alcohol. In general, alcohol can increase the liver toxicity of methotrexate, but there's no magic threshold. So the easy answer is to say don't drink alcohol at all. But most physicians, being realistic, would say, yeah, an occasional drink here and there is actually not a problem at all. But what do we mean by occasional? Occasional means different things to different people.
Okay. So what would be your version of occasional then?
I would say like one drink a day, if you drink fairly regularly, or 2 or 3 drinks at a party would be okay.
Be appropriate. Okay. All right, great. All right. So next question is, when should I take my meds? Is there a recommendation like around time of day, with food or without food?
Well, that's going to depend completely on the medication you're taking. What I would say is take your medicine when you're going to remember to take it. I mean, forgetting to take the medicine is the worst possible thing. So I'm on a couple of medicines too for cholesterol and blood pressure, and I take them in the morning because it's part of my routine. I come downstairs after shower and everything, and when I get my coffee, I don't start drinking my coffee until I take my pills. So, for me, that's the best time. Other people might want to take it at supper or at bedtime. And generally, it doesn't matter what time of day. It's pretty rare that the time of day matters. Corticosteroids like prednisone, generally you want to take first thing in the morning. But again, for most medicines, like a non-steroidal anti-inflammatory drug or Tylenol, it doesn't matter.
Great. And I know for myself, I keep my pill tray on my desk So it's right there in my line of sight to remind
Yeah,
me.
and I'm lucky I take medicines just once a day. So
Yeah, you heard the little jingling of everything in my tray there.
yeah.
So, I know I hear a lot of times from patients, that we deal with feeling nauseous after taking medication. So any suggestions around that?
Well, because most of the time you'll be told to take it with food, because that generally does help with if you're taking a pill with food or a lot of liquid that just dilutes it. In some cases, like a non-steroidal anti-inflammatory drug, some of the GI upset can be from direct irritation in the stomach, but also maybe splitting the medicine. So if you get quite nauseous from medicine, you may want to take half the dose at one time and then half a dose an hour later, again, if you can remember to do that. Beyond that, quite often when we start new medicines, we may feel a little bit sick to our stomach, but we get kind of used to that or tolerate it a little bit better after time. So I would say if it's an important medicine, just stick with it, take it with food, and hopefully it'll all work out.
Great. And then are there, another question that came up around this topic is, are there any food or drug interactions with arthritis medications that I should be aware of?
Not really for arthritis medicines. Certainly it's possible. Food generally doesn't matter a whole lot in terms of interaction for meds that I can think of offhand. Drug interactions is going to depend a lot on what else you're taking. Certain medicines like blood thinners are notorious for having drug interactions. So if you take a non-steroidal anti-inflammatory drug with a blood thinner, that could be important. But the important thing about drug interactions is generally you can still take medicines together. You may just have to adjust the dose of one or the other. So we can generally work around those kind of things.
Right. Well, and that's where working with your pharmacist would be a benefit, because you're going to educate us on those interactions and then work with our physicians. Right. Great. I've heard this also, and this has come up in our online community. I'm worried about prescription medication side effects, and what are the most common ones, and when should I be concerned about side effects?
Well, that's a very general question, so it depends completely on the of the medicine. Again, things like nausea are common with most medicines and don't mean you have to stop taking the medicine. I would be more concerned about something that is not transient and is more severe. So, something severe like if you're bleeding, that's pretty important. You need to be concerned, that's obvious. But if something is bothering you and is persistent, I would definitely bring it to the attention of your physician and or pharmacist and see if there's a way to manage that or to change medications.
Great. And then another one I have, and this one I actually heard just this week. I just got prescribed a medication with a black box warning. What does it mean, and should I be concerned?
Yeah, so all medication labels have a bunch of warnings, because the warnings really talk about all the different side effects that were observed in clinical trials and may or may not happen to you. The black box is in a black box, literally, because it's kind of important. There's so many warnings on a drug label that the black box is like, hey, if you pay attention to just one warning, this is it. And it doesn't necessarily mean it's something that's going to happen to you. It may or may not be a necessarily even serious adverse reaction. It's just saying, hey, pay attention, take this with food or check for drug interactions or talk to your doctor about this. So it's a warning you should pay attention to, but again, don't get too worried if the medication you take has a black box warning on it.
Okay. Yeah, I especially hear that concern come up with when individuals are newly diagnosed, and it's like, oh my God, it can potentially cause XYZ, right?
Yeah.
All right, so let's switch gears here a little bit. And let's talk a little bit about some of the over-the-counter medications. So which over-the-counters or OTCs are best for osteoarthritis? Because I know we've got acetaminophen, ibuprofen, aspirin, and is it okay to combine?
Yes, first of all, it is okay. Now, you don't want to take more than one non-steroidal anti-inflammatory, so I would not take ibuprofen and aspirin together or ibuprofen and naproxen. But you can use acetaminophen along with a non-steroidal. That's actually a good way to perhaps boost the pain relief that you get. Which one is best? It varies from person to person, which is actually true for most medications. One person can respond much better to a medicine than their friend does. But speaking in generally, acetaminophen is a little bit weaker than ibuprofen and naproxen and aspirin. On the other hand, acetaminophen is the safest medicine. So what we usually recommend is for someone, say, with new osteoarthritis diagnosis, let's try acetaminophen first. If it works, awesome. If it doesn't, then you can add a non-steroidal or you can just switch to a non-steroidal anti-inflammatory drug.
Great. Okay, next question. What's the difference between OTCs and prescription topicals? And how do I know when I need one over the other?
Well, that probably came up as a question because of Voltaren, which was prescription only, and now is over the counter. So, what's the difference between any OTC and prescription? It's actually it's safety for self-use. So, any new medication automatically becomes a prescription medication. However, after some time, a pharmaceutical company can submit an application to the FDA for a switch to over the counter. In order to make a medication available over the counter, the pharmaceutical company has to do studies to show that it's safe and used correctly with only an over the counter label. So, medications that have complex instructions or difficult or severe adverse reactions probably won't go over the counter, but Voltaren is a great example. They were able to show that given the label that's on the Voltaren product, that patients indeed generally understand what to do and they use it correctly. So that's the general difference between those medicines. How do you know when you need one or the other? It's hard to say. There are a lot of topicals that are effective. Outside of Voltaren gel, and there's Aspira cream. There are a lot of products that contain capsaicin, which is a whole different medication, and that will help some people more than Voltaren. So, like a lot of things, you probably have to try one, see if it helps, and if it doesn't, try a different one for a while.
A little bit of trial and error there
Yeah.
to find your favorite, which sort of, again, points to sort of my next question, which when we're talking topicals, what are the best ones for pain versus inflammation versus stiffness? Any suggestions there?
Well, capsaicin is really just for pain. Capsaicin, people may know, is derived from red chili peppers, and so it actually stings a little bit when you first put it on, but over time you get a little bit numb. And so that's good for pain alone. If you have a lot of inflammation, then I would use more of a non-steroidal anti-inflammatory drug. So Voltaren would be really good if you have, say, a sore knee with rheumatoid arthritis and you're trying to manage that.
Is it okay to mix over the counters with biologics?
For the most part, mixing over the counters with arthritis medicines is okay. With biologics, definitely. Biologics are actually pretty safe drugs, luckily. And I can't think of any over-the-counter product that would interfere with a biologic at all.
Great, good to know. Now, switching gears again, a question that came up is, can medications affect fertility?
Well, it's a tough one. But in terms of arthritis medicines, generally, no, they don't affect fertility. Methotrexate and leflunomide are teratogenic. They can cause birth defects, so I would avoid those, of course, if someone's planning to become pregnant. The only medication in everyday use for arthritis that I can think of would be something like cyclophosphamide, which is not going to be used very often except for lupus. Cyclophosphamide is more of a chemotherapy drug that could cause infertility, but for the most part, arthritis patients don't have to worry about that.
Okay, great. And then we also have a related question. Do I need to stop taking certain medications during pregnancy?
Yeah, that's a good question, very commonly asked question. The American College of Rheumatology, and I think maybe it took in combination with the Arthritis Foundation, recently published a very good article on that. Most of the medicines we use for arthritis can be used during pregnancy, with maybe some cautions or attention to which part of pregnancy you're talking about. So you do need to stop getting methotrexate and flonamide because it can cause birth defects. The latest recommendation is also to generally avoid non-steroidal anti-inflammatory drugs, especially in the second half of pregnancy. That's not an absolute, but it's better to avoid them if you can.
Okay. Good information here. Now, we had this question come up in our online community. Is there a safe way to take NSAIDs if you have a stomach ulcer?
Yeah, and that is another common issue is non-steroidal anti-inflammatory drugs do cause stomach ulcers. So what if you've now had an ulcer and you still have raging inflammatory arthritis? So we can protect our stomach in a couple of ways. Celecoxib or Celebrex is a little safer for the stomach than the other ones. And so if you really feel you need, or your doctor feels you could benefit from a non-steroidal, Celebrex is probably the preferred medication. We can, in that case, just taking it with food won't help very much. But there are a couple of medicines that are very effective in protecting the stomach. One is called Cytotec. That causes a lot of side effects, not used very much at all. But most people will take a non-steroidal with a medication class called a PPI, or proton pump inhibitor, Prolozec being a good example of that. So these proton pump inhibitors reduce acid secretion, and they are very effective in protecting the stomach. So ideally, if you had a recent ulcer, again, you would avoid a non-steroidal, but there's certain patients who really need that medication. And again, I would combine it with a PPI.
Yep, there's one of those in my pill tray for that. So are side effects different for oral versus injected methotrexate? And is one more effective than the other?
Yeah, that's a very good question too, because so many people use methotrexate for inflammatory arthritis, and it does cause a lot of nausea early on, especially. So the difference with injected methotrexate is that it does not go through the stomach. And when you take an oral medication, not only does it go through the stomach, but when it's absorbed, it passes through the liver. And so taking injectable medicine can be a really good way of avoiding nausea from methotrexate, or at least minimizing it. You also get complete absorption. And so generally, injectable methotrexate is a little bit more effective. Lots of people don't like taking injections, but if you don't mind it, it's actually probably a better way to take the methotrexate. So it'll be better tolerated, less nausea, and less potential for liver damage.
Great. Awesome information there. And then my final question for you is, what's the difference between biosimilars and biologics?
So the simple way is biosimilars just are generics. Of course, regular medicines like methotrexate and non-steroidals are pretty simple chemical molecules, and it's very easy to make an imitation generic. Biologics, on the other hand, are very, very large, like 100 times, 1,000 times bigger than a typical medicine. The proteins are very complicated, and so they're very hard to duplicate. So instead of calling them generics, we call them biosimilars. The imitations are called biosimilars. And they have to go through a lot tougher standard because it's really difficult to create this imitator that's close enough to the original biosimilar to be effective. But the technology for that is just crazy amazing. And so generally, The biosimilars on the market that have been approved by the FDA are just as good as a biosimilar. And hopefully it'll be a little bit cheaper for you, but it depends a lot on your insurance plan.
Great, thank you. Well, thank you for taking your time today to answer the questions from our patient community. And I want to thank the patients who submitted their questions so that we could have this conversation with you. And we appreciate you coming in and educating us and providing sound advice today. So
you're very welcome.
I really have enjoyed speaking with you. So next month, you guys, we're going to do this again. So if you're curious about what next month's topic is, visit the Live Yes online community at liveyes.arthritis.org on May 1st. We'll reveal the next topic in Ask the Professionals Q&A, and you can submit your questions there. To learn more about the Arthritis Foundation and the awesome programs and services we offer that we provide to the community, we invite you to visit our website at arthritis.org and learn more about our patient education webinars, our podcasts, our connect groups, the online community, and our Insights program. So we'll look forward to seeing you in the future. And again, thank you so much, Don, for joining us today.